Hello everyone, in this video we'll talk about the first pass metabolism of the liver, which also act as the second barrier. Now in the first video of my pharmacology series, I have listed a video where I'm talking about pH as the barrier, which is also the first barrier. Now this is the second barrier. This is the second barrier. Now let's talk about how liver is acting as a barrier. Let's say that you give a drug orally to a patient, right? It goes through the different parts of the GIT and it gets absorbed from your small intestine. Now these small intestine, it will drain into various veins which will drain into portal vein. Now this portal vein will drain its blood into liver. As you know, it will drain its blood into liver. Now this is liver. Now this is all a rough diagram just to tell you about how a drug undergoes the first pass in the circulation, and in this first pass they are undergoing the degradation. So this blood will drain into the portal vein. From the portal vein the drug is draining into the liver, and from this liver this blood is drained into the inferior vena cava. And you know that inferior vena cava drains its blood into the right atrium. From the right atrium it goes to the right ventricle. From the right ventricle it is going to the lungs. It is going to the lungs. From the lungs it is going back to the left atrium. From left atrium it is going to left ventricle, and from the left ventricle it is going to the systemic circulation. Systemic circulation provides blood flow or blood to all the systemic organs and tissues of our body, right? So we can say that to reach the systemic circulation, this oral drug which we have taken through oral administration have to undergo a first pass metabolism, which is there in the liver, which occurs in the liver. So in the liver there is degradation of the drugs. So if the amount of drug in portal vein is 100%, the amount of drug which is there in the inferior vena cava is around 60%. So around 40% of the drug is getting degraded in the liver. This is known as the first pass metabolism of liver. It means that when the drugs take one pass through the circulation, it undergoes first pass metabolism in the circulation, and that's why it is known as the first pass metabolism. Now let's suppose that there is a drug which has high first pass metabolism. It has high first pass metabolism. Now because of the high first pass metabolism, the physicians, they like to give this drug either in high dose. Because you know that even if there will be increased degradation of the drug in liver, still there will be drug left which can cause therapeutic effects if you are giving it in high dose, right? Or what is the other option? If you want to prevent this first pass metabolism, do not give the drug orally. So some of the drugs, they are not given orally. Now how are they given then? They are given through the parenteral route. Or they are given through the enteral route. Now enteral route, as you know, it consists of oral route, it consists of sublingual route, and it consists of rectal route. So other than oral, we give it through sublingual route and we give it through rectal route. So these drugs which are not given orally to prevent their first pass metabolism are either given through injection or non-injection route of the parenteral route, or they are given through the sublingual or the rectal route, right? So this is the first pass metabolism, and it's a mess here, but I hope that you understood the whole concept, how liver is acting as a barrier to the absorption, how liver is decreasing the bioavailability. Now one more thing, as you must be knowing that bioavailability is the extent of the drug which is absorbed into the systemic circulation in a given amount of time. So there you had 100% of the drug in the portal vein, but what is left in the inferior vena cava? It is only 60%. It means the bioavailability of the drug will decrease. Why? Because of the first pass metabolism in the liver. So when you talk about the factors which affect the bioavailability, one of the factor is first pass metabolism, as it decreases the bioavailability of the drugs. This is it for this video, guys. This is me signing off. Have an amazing day.